Hi guys, Dr. Lester here, and today I would like to talk to you a little bit about artificial sugars. And the problem with artificial sugars is that they are marketed as this good alternative to sugar, and they are marketed as, yay, go sugar free, diabetes means you need to go sugar free, and all of these things. And the problem is that they are almost, well, not even almost, they are definitely worse for you than just having the sugar. Now, should you decrease the sugar? Yes, so that's a whole nother topic. But as far as artificial sugars, there are only a handful that are actually okay. Most of them are really pretty bad for you. So the biggest problem with artificial sugars is that they are extremely sweet. So 9 to 10 times the sweetness of what regular sugar is. And the problem is that you're like, oh, well, I can do less of it and get more and blah, 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 but that's not how it ends up working. The problem is that your brain ends up registering this level of sweet and this level of sweet and this level of sweet till eventually it kind of raises that bar, and you now have to, you kind of developed a tolerance of sorts. So now you have to have more and more and more and more to satisfy your sweet tooth, and that is not good. So it's already trying to lie to your brain a little bit, but on top of that, it actually bypasses your bloodstream. So the problem with that is that usually when your body is registering that you have a high blood sugar level, the reason for this is because you ate something, right? So it's saying, okay, well, we ate some stuff, we gotta go digest it, gotta send out insulin and ghrelin and all of these other hormones that help process the food that you ate and your blood sugar levels, but there's no sugar in your system. Instead, there's this weird stuff that nobody knows what to do with because it doesn't match what the body has, but it's telling your brain, no, there's sugar. And your body's looking for the sugar and it can't find the sugar, but it keeps telling it there's sugar, but there's not. So what do we do about that? Ultimately, the problem is that you are telling your brain that the information that's coming from your body is a lie. And so then your brain is going to say, okay, well, if the body's lying, then we're not going to register that anymore. We're not going to waste time on that. And it no longer listens to insulin or to these other hormones, or maybe it's ghrelin or whichever one. These other hormones that are telling your body that there's high sugar in your bloodstream. And when that happens, it definitely predisposes you more to these conditions, because now your pancreas isn't functioning appropriately the way that it should. And this is a problem. So as we look at some of these things, I definitely want you to think about how this is really truly impacting it, and are you making it better by going sugar-free? Because in those instances, it's better to just have the sugar and have your brain register, okay, yes, there's too much of this, but at least we know how to process it. At least we know how to get rid of it. And at least the body isn't being lied to shut something down and being told, no, you're wrong for doing the thing that you're supposed to be doing. So it's truly important that we avoid artificial sugars, because it's creating just this cycle of effects that is so much worse. And this is a difficult one because sugar is hard to give up. Sugar is super addicting. It literally works as an addictive substance, probably worse than cocaine, more addictive than cocaine. It's really bad. Anyways, so as you're looking at these, I definitely want you to think about that and strongly consider managing your actual sugar intake rather than having artificial sugars as a replacement, because you're not actually doing the work. Then you're creating more of a problem. Now, there are two artificial sugars. well, there are variations of two, but really two types of sugars that are artificial that are less bad. Now, they still kind of do the same thing, but your body can at least understand it a little bit better. And so they have less of a huge traumatizing impact on your system. Now, those two are stevia and sugar alcohols. Now, you will find like sugar alcohols pretty commonly if you go look at like the different types of chocolate bars, the fancy chocolates. You'll see a lot of the sugar alcohols in those. Sugar alcohol it's processed differently, so it's not the best, but at least it's normal things that your body can understand. Stevia is similar. Stevia has quite a high, it's still much sweeter than actual sugar, but it's not quite as high as things like Splenda, which are just really high. So you're not tricking your brain quite as much. It doesn't have the same insults, and it comes from a plant, so it's a little bit better. It's not used the way aspartame is used, so definitely just a better route to go with those things. So as you're looking on the backs of things to wonder whether or not it has artificial sugars in it, I definitely recommend that you should get these names kind of straight. So it's a little bit confusing because sucrose is sugar, right? It's normal natural sugar, and that's okay. Sucralose is an artificial sugar, and you don't want that one. Then, of course, there's the aspartame, which most people know. So those are pretty much the two common ones, but sucralose and aspartame are a big no-no. You don't want those in your system because they will be the ones that cause problems. We can go into some other routes with that, but definitely sticking with those two is pretty important to eliminate. But like I said, sugar alcohol and stevia or Truvia, those are actually fairly acceptable, but again, use them in moderation, because the whole goal is to train your brain to want less sugar, because that's really the problem, right? It's that it's an addiction, and your brain needs that sugar to maintain that addiction. So that's kind of my spiel on that. It can be a pain to eliminate that, and it's kind of opposite of a lot of what's told to you, unfortunately, in I guess by normal nutrition standards. I know that I was at the hospital with my ex one time, and he was in there for, I don't remember what, some cut or something, that he was a diabetic, and it got really out of hand, and their food protocol for diabetics included the most ridiculous things I'd ever seen. It included like ice cream, and he could have ice cream and French fries and hot dogs and pasta and diet soda in one sitting, and I was livid. I went and talked to them. I was like, when was this? Who created this? When was this acceptable? And they were like, this is the standardized food protocol. And I was like, it is completely antiquated, because that has been way proven wrong, like for the last like 30 years, like this is not okay. And so I would have to like bring in our own food, because it was just making a situation worse, and you're not teaching a diabetic to eat better, like if anything, you're teaching them that this is okay. Anyways, so getting off my high horse there, but definitely diet soda is not okay. Diet sweets or popsicles or whatever else, they're not a good alternative. Artificial sugars are not a good alternative. They make things worse. They really do. So I hope that helps a little bit, and if you have any questions, please don't hesitate to ask, whether it comes to food labels or what's appropriate or what's not, or how to manage some of that blood sugar a little bit more. You can just give us a call. Thanks, guys.